thank you for any new viewers. I'm Dr. Delana Wardlaw, board certified family medicine physician,
And I'm Dr. Elana McDonald, board certified general pediatrician.
and we are the Twin Sister Docs.
Today, we're going to discuss medical myths.
There are plenty of medical myths, and in this day of social media, everybody has an opinion. Everybody has some information. So we're here today to make sure you have
The correct information. Let's get started, Dr. Wardlaw.
Yes.
Let's talk about a very common myth that's out there. You can catch a cold from going outside in the cold weather or going outside after washing your hair.
No, no, and no. That isn't true. A myth. That is not fact. When you go outside, you're exposed to cold weather. Now, if it's very cold, you run the risk of getting frostbite, which is another medical condition. However, you will not catch a cold from going outside with your hair wet or without a hat on your head. You actually have to be exposed to a virus in order for you to catch a cold. So no, that is a myth. Your mother will yell at you, "Don't you go out there without zipping up your coat. You're going to catch a cold."
That's
No.
not true. That's not true. And I often point out to all of my family and friends who watch sports, watch football every week, we see many sports teams out there in the dead of winter. We see the players out there. Oftentimes, they're out there just in their uniforms. They do not get sick. Now, they have to make sure that when it's super cold, that they're covering their head and putting on gloves because, again, as Dr. Wardlaw said, you want to prevent frostbite. But again, these athletes go out there every week, week in and week out, and they do not catch a virus from being out in the cold weather.
Now, we're not telling you if it's cold outside, don't put your hat and coat on, because you do need to be able to protect yourself from the elements. And definitely, children, listen to your parents that you go out there and take your coat off. And we're not telling you that. We're simply saying that you will not catch a cold or you will not
Get a virus.
From going outside in the cold weather.
And if you have to run outside quickly after washing your hair, you're not going to get sick because of that. Now, you may feel uncomfortable being out there, but you're not going to get a virus from being out in the cold weather. Again, you have to be exposed to the virus to contract the virus.
Yeah, that's a very common one that we hear. And following up on that, another one that we commonly hear is about the flu vaccine.
Doc, I do not want to get the flu vaccine because I don't want to get the flu.
That's another myth. You absolutely will not and cannot get the flu from a flu vaccine. I'll say it again. You absolutely cannot and will not get the flu from a flu vaccine.
Yes.
Now, you may develop some side effects. You can develop some body aches. You can develop some soreness at the site of the injection. You can develop some low-grade fevers. I guarantee you, you will not catch the flu from the flu vaccine.
Exactly, Dr. Wardlaw. Let's move on to another common myth that we hear. Doc, my child, they're coughing, they have a runny nose, and the runny nose that mucus is green. So that must be a bacterial infection. Dr. Wardlaw?
That is not always the case. The color of mucus does not indicate if you absolutely have a bacterial infection or not. We see many of discolored mucus, green mucus, yellow mucus, and it is many times associated with a virus. What we're also looking for are other signs and symptoms that could suggest that it is a bacteria. If you're running, high fevers, if you have an abnormal exam, throat exam, an abnormal ear exam, if you have an abnormal lung exam, we look at your blood pressure, we look at your heart rate, we look at all of these things to determine if it is more likely to be a bacteria, if it's more likely to be a virus. So, one, the color of your mucus does not indicate
that it's a bacterial infection.
So
please do not call your doctor and say, my child has a green runny nose, he needs an antibiotic, because most times that is not the case.
Same thing for adults, because, as a family medicine physician, I see children and adults. I often get the call, "Doc, I had this thick green mucus and I need an antibiotic. Oh, I need Ziftomax." Yeah, we hear the stories about Ziftomax all the time. Probably one of the most overprescribed medications on the planet. We have to look at other signs and symptoms and determine if it's a bacteria or not.
Let's move on to the next myth. Dr. Wardlaw.
Yes.
I don't want to give my baby milk because he has a cold and that'll make the mucus worse.
No, well, the milk is not going to make the mucus worse. It's the actual virus that causes the increased mucus production. So no, you do not have to skip your baby's milk because they have a cold because you think it's going to cause increased mucus production. It's actually the virus that is causing the cold symptom that is causing the increased mucus production. The milk does not have any impact on that.
Yes. So if your child, your toddler wants the milk while they have a virus, please feel free to give it to them.
And so, Dr. McDonald, is that something that you hear commonly amongst your pediatric patients?
I hear it quite frequently. The parents, when they come in for the visit, the parents will often say, well, he has a cough and a runny nose, and I stopped giving him the milk because I didn't want to make the mucus any worse. So that's my time to chime in and say, hey, listen, he has mucus because he has increased mucus production because he has a virus. The milk is not going to make that any worse.
Talking about this pediatric population, Dr. McDonald, a myth that we very commonly hear, my baby can't sleep. I need to add some cereal to their milk. Dr. McDonald, can you please talk to that?
You do not need to add cereal to your baby's milk. First off, infants do not sleep throughout the night. The earliest they sleep throughout the night may be about 4 months of age. And most, let me be clear, most infants are not sleeping through the night at 4 months of age. So one, the expectation has to be clear that your newborn is not going to sleep through the night. And newborns are going to wake up every couple of hours because they need to eat every couple of hours. So you do not need to add any cereal, any other baby food, or anything to your infant's milk. When we start to introduce baby food, when the time is right, and usually that's going to be around the time between 4 and 6 months of age, the recommendation is to offer to them off of the spoon. Do not put it in the bottle.
Yeah, so, we always have, you had it Aunt Ella.
Yes.
Oh, get that baby put some cereal in this milk so he gets some sleep. Well, as Dr. McDonald said, baby, the infant is not expected to have a whole night's sleep. And for that reason, the mother is not expected to get a whole night's sleep either. If fathers too, dads can step in here too as well. Mom doesn't always have to be the one getting up, getting the baby. But what the expectation is, baby's not going to sleep through the night. And as parents, we have to sleep when the baby sleeps.
Exactly. Sleep when the baby sleeps.
Yes. Dr. McDonald, let's talk about more of sleep issues.
Yes.
Is it okay to give a child a medication or herb to go to sleep?
A healthy child does not require any sleep agents to go to sleep. The biggest thing that we have to focus on is one, what we call good sleep hygiene. Making sure that you're doing all the things that you need to do to make sure that the child is going to sleep. One, having a scheduled bedtime. Two, making sure all of the lights, the electronics are off. And those things is what helps the child sleep throughout the night. Again, we do have some children who have underlying medical conditions that leads to sleep issues. But in general, if you have a healthy child, a healthy toddler, they do not require sleep agents to go to sleep. It really is the environment that you're creating around them.
What about melatonin? They package these melatonin in these gummies. They look so nice and shiny.
Again, a healthy child does not need sleep agents to go to sleep.
Okay, so let's make it clear. Do not give your child any sleep agents.
Yes.
And please, if you're even considering it or thinking about it, have a conversation with your physician. Please just don't go and just because it's over the counter doesn't mean that it is okay. So please have a conversation with your doctor. All right.
So, Dr. Wardlaw, what common myths do you hear in your office?
Well, so one that I commonly hear, which really can prevent people from getting the care that they need, as many times patients are coming and say, "Oh, my mom had cancer, and as soon as when they opened her up for surgery, it spread all over her body." Well,
that is an absolute myth.
That is a myth. Now, when a patient goes in to have surgery done, the surgeon has already determined what technique they're going to do, how they are going to either biopsy an organ that they think has cancer, or how they're going to remove the organ. special techniques. There are sterilization of the instruments and of the tools and everything. So the cancer is not spread through that method. This method of, as soon as when the air hits the cancer cell, it spreads all over the body. Not true. So I implore you, I hear this very commonly. Oh, they opened up my mother and her cancer just spread everywhere. No, it's not because they opened up your mother and the air came in contact with the cancer cells and it spread everywhere. That is a myth, and I really want to encourage people that if they have that thought, if they are considering not getting a surgery down on an area that has been determined to be cancer, then you really, really need to rethink that and have a conversation with your physician, because open you up, the air is not going to cause the cancer to spread.
Great. So if the doctor is recommending the surgery, please do not let that be the reason for you to say you're not going to get the surgery, because it's a myth.
Yes. Now, you have other reasons why you may be concerned about getting a surgery. And some people decide at some point that they're just not going to have a surgery. But please make those decisions based on accurate information and not myths. Please make sure it's based on correct information.
Dr. Wardlaw,
Yes.
You got another myth right on the tip of your tongue. What is it?
So the myth is that you have to have a bowel movement every day. You do not. Now, if you have a bowel movement every day, that's fine, but you want to make sure that it is of a good form, soft consistency, kind of like log-like. You don't want it to be hard pellets. You don't want it to be watery stools. And you also want to make sure that, look at your stool. Make sure that you don't have any blood in your stool. Make sure there isn't any blood in the toilet bowl. Now, there is not a normal pattern of bowel movements. My bowel movements are different from Dr. McDonald's bowel movements, or different from Mrs. Jones' bowel movements. But what you have to recognize is what your pattern is, and if you notice a change in that pattern, right? So if you're having bowel movements every day, and then all of a sudden it changed to every 4 days, and now you're having straining and you're having blood associated with it, yes, that is something that is of concern. You need to discuss that with your doctor. But if you're having bowel movements every 2 or 3 days and you're soft, it's easy for you to go. You don't have to spend 20 minutes in the bathroom trying to force yourself to go. You don't have any blood associated with it. That is okay if that is your normal pattern. Now, if you're going to the bathroom every day and you are having blood in your stool, you're having black stools, you're having hard stools, like hard balls, hard pellets, that's not normal. Even though it's happening every day, that's not normal. So you want to be in tune as to what your normal bowel habits are. There isn't one normal pattern for everybody. Your pattern is different from the next person, but you have to be in tune as to what your pattern is.
And that's the same thing with pediatrics. Parents, especially parents of newborns, get concerned if their baby does not have a bowel movement. And it happens all the time. They're going to the bathroom when they're in the hospital, they come home and they started, they're not going every day, doc. And that's okay, because they'll say, my baby's constipated. And my first question is, well, why do you think they're constipated? Tell me about the poops. And as Dr. Wardlaw said, if the poops are soft, and usually I use food to describe poops. I always say for a newborn, it's going to look like either Gould's brown mustard or French's, or, the French's yellow mustard. It's going to be seedy. So it's going to have that consistency. If your baby is going every 3 to 4 days and it's soft, there's no blood in it, that's okay. Now, if your baby is going 4 times a day and they are hard and you're seeing blood in it, then that is constipation and it does need to be addressed. But again, the baby does not have to go every day. Your 2-year-old does not have to go every day. It's more so, what does the poop look like when you go to the bathroom?
So for adults and for children, you do not have to go to the bathroom every day in regards to bowel movement. So just be in tune as to what your normal pattern is, and be in tune as to what is abnormal, as those things that Dr. McDonald and I just spoke of.
Now, to piggyback on that, Dr. Wardlaw, do people need to go and get these cleanses for their GI tracts, colonics? Is that necessary?
So listen, the body is a well-crafted machine. And the body does a very great job of detoxifying itself if things are working appropriately. You have the liver, great organ that works to detoxify the body. You have the kidneys, great organ that helps to detoxify the body. Your colon. Your colon is this tubular structure in your abdomen that is about 6 feet long. And guess what one of its jobs is? To store the poops. It stores feces. So at any given time, as long as you are eating, you will have feces in your colon. That is normal, and it is eliminated on every so often. So you do not have to have your colon cleansed, with one exception. If you're going to get a colonoscopy,
The good old colonoscopy that we have already talked about in previous episodes.
Yes, because in order for the doctor to be able to see what's going on in the colon, it has to be cleared of all the feces. So that is an instance where you absolutely have to clear all of the feces out of your colon. But other than that, the best way to control what comes out of your colon, ding, 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 what you put in it. So you have to be mindful as to what you are eating on a regular basis, making sure you're getting hot fiber, making sure you're getting good hydration, making sure you're getting good protein, making sure that you have a well-balanced diet to make sure that you are having, regular bowel movements. So no, you do not need these colon cleansers. I used to work in a doctor's office where colonoscopies were done. And the first thing people would do when they came in on the morning of their colonoscopy after they did the prep, they would jump on the scale. Let me see how much weight I lost. On average, they probably lose maybe about 3 to 5 pounds. And guess what? The next week, 3 to 5 pounds will be back. So again, you do not have to depend on these colon cleansers, these detoxifiers. You can rely on yourself, but you do need it for a colonoscopy. Now, we know many people who complain about the prep for the colonoscopy. That's the time that you need to be doing it and cleansing out your colon. But the average healthy adult, your kidneys are working, your liver is working, you have a good diet. Like, you do not have to cleanse your colon. And the colon is not meant to be cleansed on a regular basis. Right. The colon it stores feces. That's its job.
Stores feces till it's ready to be eliminated.
Yes.
Right. So again, we do not need these colonics. We do not need these detoxifiers. We do not need those things. You must control what you put into your body to make sure that you get the best results from your own body.
And I will say, now there are people who watching the podcast and they will, insist on doing I have to clean out my colon, or I have to, get a colonic. You really do need to make sure that you are talking with your physician and have a conversation with your physician. And if you're getting a colonic done, you have to make sure that you are going to an experienced person who is doing that procedure. You really have to make sure, because you can have complications from that as well.
Not going to these pop-up places that just shows up and say, come on and get your colonic.
And not just showing up in somebody's hotel room. Right. So just be very, very mindful of these things, okay?
There's a myth that I have to address as far as babies are concerned. Doc, can I give my newborn baby water? My grandmother said I should give the baby water. It's good for the baby. We love water, but newborns do not need water. When we talk about water, I'm talking about just regular water. Newborns do not need it. Newborns get adequate water intake from breast milk and from the water that's added to the formula. When you make the formula correctly and you add the water to it, the infant gets enough water. And actually, giving water to newborns can lead to other medical problems. It can dilute, or it can water down all of the potassium, the sodium that's in your blood. And if those levels get too low, you can see seizures, especially if the sodium gets too low. Mm-hmm. And not to mention, if you are adding too much water to the formula, you're adding water to the breast milk, then the infant is not getting the adequate amount of calories that they need to grow and develop appropriately. So I will say it again. Grandma means well, but your newborn baby does not need water. You do not need to give them water to clean the milk off of the tongue. No, you could take a washcloth, or you could take, they look like thimbles for people who used to sew, that you put on the finger. There used to be these little metal thimbles, and you could gently wipe the tongue. But I tell parents too, you're not going to get all the milk off the tongue. So don't stress yourself or the baby trying to get all the milk off of the tongue. It's okay to have a little bit of milk on the tongue.
So bottom line, do not give
the newborns water.
Please don't get the newborns water, because it can definitely lead to a cascade of other events.
It can be very dangerous and harmful to your baby.
Okay. Dr. McDonald. So let's talk about burns. Very commonly, people, we see burns quite frequently. And Dr. McDonald, people are concerned about, oh, I should put ice on a burn, or should I put other things on a burn? Can you speak to whether or not patients should put ice on a burn?
You should not put ice on a burn, because when you again, yes, when you get burned, you have the heat, you want to try to cool it, you want to try to cool the skin down. However, if you're putting ice itself on the burn, when you put the ice onto the skin, it will make the blood vessels tighten up or squeeze. And when you remove the ice, then those blood vessels, they open back up again, and it causes significant pain. So you absolutely do not want to put ice on a burn. Now, if you just want to put a cool compress on it, fine, but do not put ice on a burn.
Yes, and it can also cause destruction to the tissue, harm to the tissue as well. So you absolutely don't want to put ice on a burn. You could put put it under the body part, under like cool water, right? Running cool water. If you're able to do that, you can put a cool compress on it, but absolutely no ice on the burn. And on the other side of the spectrum is no butter on the burn. And this is an old wives' tale that I think many people have gotten away from. But just to be clear, do not put any butter on the burn either, because that holds the heat in.
Right.
And so you want to make sure that you don't do that either. So just no ice, no butter, cool running water, or a cool compress to one, help with the discomfort that you're having, and two, to avoid any further tissue destruction that you're having. And then, of course,
reach out to your doctor to make sure that they can properly treat the burn, or let you know what the next appropriate steps are.
Yes. So that's burns. Now, we got that old myth where your mother said, you're in there reading with the lights off, you're going to mess up your eyes.
Dr. Wardlaw. Is that true?
So,
or is that, please enlighten us on
So what can happen is that there's some truth to that, where you can, it can cause a strain on your eyes, right? So it can cause a strain on your eyes. It can cause some, some temporary blurriness, some temporary changes in the vision, but it's not permanent. It's not long term. But it can also cause, due to the strain on the eyes, it can cause some headaches. It can cause some lightheadedness sometimes. So it can cause these temporary symptoms, but it's not going to cause permanent blindness. Speaking to that as well, or permanent eye damage. I shouldn't say blindness, but permanent eye damage. But we also need to be careful of not only reading in the dark, or being mindful of it, because it can cause those temporary strains on the eyes, but the screen times, right? So we do know that you can get this digital strain on the eyes as well. So, something more than greater than 2 hours at a time can definitely cause, it can cause headaches, it can cause some lightheadedness, it can cause some temporary blurred vision, but it can also cause, neck pain and neck discomfort, because you're looking at a computer screen for extended periods of time. We know that COVID didn't help this, when we all went to Zooms and the kids were on devices, and so that just kind of prolonged screen times. But we do want to be mindful of the light awareness, because it can cause this temporary strain and signs and symptoms, but it's not known to cause permanent damage to your eyes.
So bottom line, if you're going to be reading, make sure that you have the light on. But for some reason, if the light is dim, you're not going to go blind. However, if you're reading, just have on a small reading light.
Yep. And also make sure that when you're on the screen, make sure you have appropriate font size. We can all adjust our font sizes on our phones and on our screens. I have to do that very commonly now at my age. Have to make some adjustments to the screens all the time, and also making sure that the screen particularly if it's like a desktop screen or something like that, making sure that it's
at a good
like
level.
arm's distance away from you and it's at a good eye level.
One last myth I want to address, Dr. Wardlaw. You often hear people say, you're eating or drinking too much sugar, that's going to cause diabetes. Can you comment on that?
So, not that it is going to cause diabetes, because we have people who eat various amounts of sugars all the time. But we do know that your diet does have an impact on you having diabetes or you developing diabetes. We know that people become pre-diabetic. And one of our key things is making sure that you monitor your diet, limit the amount of sugar that you're taking. And however, the direct correlation of you eating high amounts of sugar causing diabetes, no,
that is not true.
Exactly.
But your diet does have an effect on whether or not you can develop diabetes later.
Yes, it increases your risk of developing diabetes. Yes.
Right.
As one last myth I would like to discuss is, if I take cranberry juice, will that
cure my urinary tract infection?
Will that cure my urinary tract infection? It's not going to cure urinary tract infection. However, we do know that cranberry juice causes the urine to become acidic and makes it difficult for bacteria to sometimes thrive. So there has been some, you hear all the time, drink cranberry juice. It can help to decrease the UTI from coming on. However, the amount of cranberry juice that you have to take in with the amount of sugar that's in the cranberry juice, when you weigh that balance versus, making sure you drink enough water, making sure you wipe from front to back to prevent urinary tract infection, that is more productive than drinking large amounts of cranberry juice with high amounts of sugar in it that can lead to other problems. But the science behind it is that the bacteria has a difficult time living in an
acidic environment from cranberry juice.
But we are not using cranberry juice itself
to treat a urinary
tract infection.
So when grandmom says, oh, the doctor said you have a urinary tract infection, drink some cranberry juice, that is okay.
It's okay for you to do that, but you also want to take the medicine too.
Exactly. You still need to take the antibiotic that your doctor prescribed.
Yes.
So,
well, with that, we're going to wrap it up, and hopefully you've learned some information about the common myths that we very commonly hear. And thank you for tuning in to the Twin Sister Docs podcast.
Have a good day.
I threw that before.